Hi everyone, welcome back to my channel. My name is Barfin. I'm a doctor of physical therapy and I specialize in oncology and lymphedema rehab. In this video, I want to talk about a common condition following breast cancer treatment, which is called fibrosis. Fibrosis is the formation of fibrous scar tissue as a result of an injury. With breast cancer, most commonly it happens following radiation. However, some patients can also develop it after their surgery, such as lumpectomy or mastectomy. More commonly, it develops weeks or months after the treatment, but some patients can also develop it even years after they complete their treatment. If you have fibrosis, your skin and soft tissue in the treated area will most likely feel firm, thick, hard, and tight. It can also feel tender and sensitive when you touch it. Fibrotic tissue can also be painful and limit your range of motion, so you may feel pulling and discomfort when you try to reach all the way up with the affected arm. It can also have an impact on your lymphatic system and slow down the absorption of fluid in that region, and that can result in localized swelling. And in that case, you may feel fullness and heaviness either in your breast or your armpit region. Before we start working on the treated area, we want to make sure our skin fully heals. So if you're recovering from surgery, we want to make sure all the stitches are out and your incision is fully closed. And if your skin is healing from radiation, you want to make sure all the redness has resolved, there's no blisters or wounds in that area, and your skin no longer feels sensitive or fragile to touch. So after your skin fully heals, you can start massaging the affected tissue to soften that area and break down the fibrotic tissue. When you're massaging, you can continue to use your moisturizer that you were given during radiation. However, you can also use another cream if you prefer to. I love using Eucerin in my clinic, but there are other good brands like CeraVe or Cetaphil. If you're not sure which cream to use, or if you have a skin condition, I would highly recommend reaching out to your doctor. You can also work on mobilizing your skin and the tissue in the affected area. So you can go ahead and place your palm on your skin and move it around in all directions to see if it feels restricted in a certain direction. Most commonly in my experience, this area tends to be a little bit more restricted going out towards the shoulder and also up. So when you feel the restriction, you can go ahead and stretch your skin in that direction. So you're pulling and stretching your skin in the direction of that restriction. Initially, you can hold that stretch as you tolerate, but over time, we want to build that up to 30 seconds, 60 seconds, and ultimately 90-second holds. If you don't feel an effective stretch using your hand, you can also use a non-slip tool to help you. In my clinic, I use Dyson. I'm going to leave the link and the name in the description box below. However, you don't have to purchase that. If you have any other rubbery material in your house that you can utilize, you can absolutely use that. Just make sure whatever you decide to use is not causing any reaction in that area. I also love using medical foams in my clinic to break down the fibrotic tissue. These two are the most common ones I use. I usually start my patients with the gray foam, which is a little softer, and then when they're ready, we graduate to the yellow one, which is a little denser. I'm gonna leave a couple of links for these as well in the description box below, so you can take a look at them, and if you're interested and you need them, you can purchase them. These usually come in a roll, so you can go ahead and cut them to the size and shape you need. So for example, if you developed fibrotic tissue after your breast cancer surgery and your incision was in your armpit and this is where you have fibrotic tissue now, your foam for that region would be something similar to this one. I usually recommend wearing the foam for about 30 minutes or as tolerated, but once it becomes painful or uncomfortable, you can go ahead and take it out. If you're not sure how to use the foam or cut it, or if you need a little bit more compression than the foam, you can also use lymph pads. I'm going to leave a couple of links for these as well in the description box below, and I'm going to organize them in the order of from less compression to more compression. And lastly, in addition to these tools, you can also perform flexibility and mobility exercises to improve your flexibility, reduce stiffness in the affected region, and also increase your range of motion. If you're not sure which exercises to do, I'm going to leave a link up here. You can go ahead and click on that link and do those exercises, or you can also click on the links at the end of this video. But that's it for this video. I hope you found this information helpful. If you know anyone who was diagnosed with breast cancer and they're either undergoing treatment or they completed their treatment, feel free to share this video with them. If you want to follow along and see more videos like this, don't forget to subscribe below, and you can also follow along on Instagram. Thank you so much again, and see you in a different video.